Everybody, this is Steve Cook and I'm here at Dr. McGrath's office today in Austin, Texas. Happy to be here and just heard some really great news from Dr. McGrath's video team and his staff that the videos on YouTube are really making a lot of headway with the African American patients out there, primarily African American females. This is something that he's been working on for years and years in regards to the protocols and dissecting tissue and selecting proper patients, and there's a lot involved, more so than some of the other races. Now let me be a little bit more specific. The top 3 hair types in the world are Spanish, Middle Eastern, and African American. Those are the strongest heads of hair, of which I'm not one of those, in the world. And the Spanish and Middle Eastern hair types are also very dense and normally very thick in regards to what's called caliper, like your blades of grass in your lawn are either thick or wimpy and thin. The parts of the world which are more challenging, Scandinavian, Western Europe, other parts of the world like the Asian, the Pacific Rim, have really good hair, but it's also very sparse. So today we're going to talk about the African American patient and some important information that you, as a viewer, as a consumer, hopefully you don't have hair loss, but if you ever do, this might be very helpful to you. The African American female patient is someone that I want to start off with. African American culture has been known throughout time to wear their hair in braids. It looks beautiful, and they're able to tie their hair in ways, for what I'm guessing, because I have some friends that are literally from Africa, of keeping it from the elements or whatnot. What this has done, if it's done too tight over time, is it'll put tension on the actual hair, and we refer to it in the industry as traction alopecia. One of the tips I'd like to give our African American female patients comes from the heart, and when I say that, it's because I've had experience directly with a few patients which broke my heart. When someone loses their hair, it's horrible. When someone comes in to have that fixed, it's a great thing if the doctor can help them. What's really horrible in that situation is if we can't fix it. In the African American female, we've had a lot of examples just through the culture itself of putting different chemicals on the scalp for whether it's straightening, lyes, different kinds of things that they put on their hair, which can cause what we call scarring alopecia. Unfortunately, patients that have scarring alopecia are not candidates for hair surgery. The hair won't grow. This is extremely important. I'll give you an example. I met with a very nice lady, 55 years old, in Houston, that was super excited to have her hair restored. And this was one of Dr. McGrath's patients. And he, of course, sent her to one of his top dermatologists that does his own pathology, which is very important with biopsies. When the biopsy report came back, she was excited, and then we had to tell her it's a no-go, which was very challenging. Now, the only good news that came out of this is we saved her $10,000 or $12,000 or $15,000 in hair surgery because that hair wouldn't grow. My advice to you, whoever you talk to about your hair surgery, is don't take it for granted that this doctor knows specifically, especially through photos or video, that you have traction alopecia. The better doctors will send you for a biopsy, and they want to see that report. And of course, this is all they do, so they're going to look at you as well. But you want to make sure that you have traction. Now, traction normally affects the frontal zone. It can affect other areas as well. That's a little more rare. Traction alopecia is when the hair is being put under a lot of stress, primarily by braiding. Could be a few other ways, but it literally pulls the hair out. And after a few times of pulling the hair out, it won't come back. So the African American female patient is someone that can no longer wear braids or has to wear wigs, and they feel like they're locked into only certain hairstyles. And to them, it becomes cumbersome. These things are very expensive, and it depends upon where they are in their life. They just want to go back to wearing their hair like all of us without really having to worry about it. So what's so different about the African American female patient when it comes to a traction alopecia? Well, there's good news. The good news is that they don't really have hair loss. I mean, they don't have any androgenic hair loss or genetic hair loss, so we don't have to worry about their hair continuing to fall out. So it's like a man having a bald spot in the back of his head when he's 25, and we don't have to worry about it getting bigger. We don't have to put him on medications, and we have no fear that after doing a procedure, it's going to get worse. So that's the good news. The bad news is being female, they're probably going to need 2 procedures. Now, this is an important part of today's conversation. Dr. McGrath and the other doctors that I align myself with in the country, outside the country, that are who I consider elite, really good at what they do, and specialists in the industry, they're doctors that are going to tell everybody you should always plan on 2 procedures. Well, why would that be? The reason for that is because these doctors, as good as they are, they can't duplicate Mother Nature in 1 procedure. No one can. Anyone that claims they can, watch out, run away. So back to the African American patient. They have that strong hair. Their hair, like the Middle Eastern, Spanish, very strong, but even more so in the African American patient, the fibrous tissue, the follicles, which the hair comes out from, is very strong. This tissue is so strong that it takes a lot of talent and skill set to be able to dissect that tissue properly. Because the stronger the follicle, the larger the follicle, and the harder it is to place these grafts or follicular units next to each other in large numbers. So for instance, I have very weak, fine, thin hair, lucky me. The good news about me is my tissue is so weak, or whatever word you want to use, it's very thin and fine. The doctor can put a lot of follicular units or grafts close together in a square centimeter, creating more hairs in a square centimeter. In the African American patient, because of the strength of the tissue, it's going to be a larger graft, which means they can't put them as close together. So that's just one point, is you will not get as many follicular units in a square centimeter for the African American patient. The good news is you don't need as many because their hair's so strong, it's going to look like more. The microscopes is a very important part in the equipment side of the industry. We're getting very technical, but I wanted to point out to the viewers that when you're searching out a hair transplant clinic, of course, all the what I call cheat sheet checklist, that you need to ask the right questions, make sure it's a specialist, is your doctor board certified. If they're not using microscopes, they're not able to trim that close enough so that you can pack more of those grafts in a square centimeter. Now, unfortunately, there's a lot of salesy stuff going on in the industry, like everywhere. So if you call up a doctor who you may or may not know everything about, and someone tells you, you don't need to use microscopes, or that's just a sales thing on its own, that's absolutely not true. We're talking about science, and it needs to be very objective. So with the African American patient, we need to trim that tissue as much as we can without, of course, transecting the follicle, because that kinky, curly hair is on the inside just like it's on the outside. So as an example, we're here in Austin, Texas with Dr. McGrath, and many times I'll hear him tell his staff, the only patient we're doing the entire day is going to be this young lady when we're going to move 2,500 grafts. Now, he has a very mom and pop boutique type brand, and that brand is based around primarily 1 surgery a day, and he can handle 2, usually a larger one and a smaller one, because he has an excellent staff and enough of them. But it slows you down when you use the microscope, but it has to be done. So these are just small tips which can help you search out where you're looking or who you're looking for in regards to having your hair restoration done. The last thing I'll tell you about the African American female is that there's a lot of variables based on the individual person. For instance, a lot of these hair transplant specialists that I align myself with do excellent work. And they have a lot of examples on their website. A lot of the examples you'll see is the African American females that have more of a straighter hair or less kinky, wirely, curly. That may be a case of those patients having maybe a Spanish grandfather or grandmother, or some Spanish in their bloodline, maybe some Caucasian in their bloodline. The African American patient that I'm going to bring to your attention that concerns me when it comes to education is literally the African American patient that is from Africa, like first generation. I have experience with these ladies myself, and their hair tends to be much more wiry and much more kinky and curly, which means the fibrous tissue is much stronger. So even using microscopes, it's harder to get these closer together than that young lady that has some Spanish in her, or possibly Caucasian in her, or Asian, or any other race. So it's very important for that specific young lady, that African American patient, let's say first generation African, that has very kinky curly hair. That hair grown out is beautiful. The shorter they cut the hair, the more you can see the space. So this is very important part of our explanation, is that when you can see space in between the grafts, is it that they didn't use proper equipment? Is it that your hair just may be kinky curlier? These are things you need to know going into the procedure. Now let's back up a sec. Let's talk about what we said originally. Everyone, male, female, any gender, any race, any age, should always plan on 2 procedures, because you just never know what that patient, as much as you talk about it, are expecting. I personally had my first surgery when I was 19. The doctor did a great job. He didn't even come close to what I thought I was getting. And he did a really good job of creating proper expectations. I was disappointed. I was so young. I wanted to look like my friends, who happen to be all Italian, and I don't have Italian donor hair. So that is where that one got off to the wrong foot. So when it comes to African American patients in general, we'll flip 1 second to the male patient. I've had a lot of African American young men that have amazing heads of hair, but it might not be as low as some of their favorite athletes, basketball players. And let me point out to you that this could be a huge mistake in taking on a patient like this, because this patient doesn't have hair loss, he just wants a lower hairline. So now, not only are you, of course, going to probably need 2 procedures, but you're competing with your own strong hair where there's no weakness. Bald people, or balding, or those young ladies with traction alopecia, have issues. They have weakness, they have poor hair, they have no hair. Myself as an example, receding hairline at one time, balding in the crown area. When you put hair in there, it looks good. When you don't have hair loss, and you're trying to lower hairlines, or you're competing with a perfect hairline, that's when you have problems. So be very careful with that. And it's more so in the African American young male patient, because they like to wear their hair very short, very low, for all the same reasons we just talked about with the females. I personally, if I had to come back in another life and have hair loss, it would absolutely be an African American female that had traction alopecia. Because as long as you choose the right doctor, the right clinic, using the proper equipment, and you plan on 2 procedures, man, they have just beautiful hair. You can take a look specifically at Dr. McGrath's website, which does have a lot of examples, and now they're putting together a lot of great videos that are more educational than marketing and advertising. But let me make one thing extremely clear. You need to make sure that you talk to the clinic about you as an individual, because everybody has different hair types, even African American females as a subset. They have different bloodlines. They have more need for hair and less need for hair. So what you don't want to do is go to a website and watch a video and build up your expectations that you're going to get that exact same result. I think that the doctors on the higher levels are putting out examples of just 1 procedure so you can see what is possible in 1 procedure, not it's completed in 1 procedure. So you need to make sure that you plan on those 2 procedures. After the 12 months, actually for females, all females, we like to say 18 months because they wear their hair longer. But after 18 months, when you look at those photos and you see the compelling change and all those hairs have grown and it looks completely natural, then it's just a matter of putting the icing on the cake or the cherry on top. If you want it a little thicker, you do a little bit more. But that 1 procedure, it should be a compelling change and you will be happy. And that's really what you're looking to have done. When patients lose their hair, myself included, it's almost like a therapy session, a process. It's like an AA meeting. There's 10 steps or 12 steps. You go through all these emotional steps, these emotional challenges. One of those steps in the process, in my opinion, is the potions and lotions step, where, you know what, I'm not going to take a medication, I'm not going to put any pharmaceuticals in my body. I'm sure there's got to be some sort of shampoo, some sort of conditioner, something I can rub on my scalp. Hair loss in general in the male body is normally hormonal. In females as well, it's a little bit more complicated. The female body, obviously, their bodies are much more complicated for all the reasons we know. In my 30 plus years of suffering, trying to battle and win the war against hair loss, I went through the same process of potions and lotions. I was trying different shampoos, DHT blockers. I mean, I even purchased some late night infomercial product that said if you rub the Helsinki formula, which was a lake up in Finland, on your head, your hair will grow back. Everybody has to go through that process. I can tell you that you need to do what you need to do to get yourself in a situation where you realize none of this stuff is really doing much good. The African American female has one thing going for them in regards to hair loss. They don't really have hair loss. Their hair was pulled out. So the good news is that you don't have to worry about this anymore as long as you don't tie your hair up really tight. The bad news is, of course, in order to get this fixed, pretty much you're going to need a hair transplant. When you have some thinning or some areas on the top of the scalp that are of concern and you feel you have the traction, there's a possibility you could have scarring and traction. Scarring on the top and then traction in the front. But in the case I spoke about earlier, it was traction both in the front and on the top, which was pretty shocking to me. So you need to make sure, because somewhere in those disclaimer disclosures that you sign before you get that expensive surgery is going to say it's not the doctor's fault if you have some sort of condition, even though he did the surgery. So you need to take your time. You need to work with your physician. Make sure it's extremely clear that this is traction alopecia, and that the only way that can be done specifically is through a biopsy. Now, there are times when the doctor knows based on what you're explaining, meaning, well, I wore my hair in braids for the last 10 years, it was in this exact area, my doctor, dermatologist in my city told me there's no question about it. I don't want to speak out of both sides of my mouth and say that's okay, don't get the biopsy. But life is fast and life is hard, and there are times when a doctor, Dr. McGrath, Dr. Cooley, Dr. Feller, these doctors have been doing this for 20, 30 years, are going to be able to say, yeah, that's traction. But there are examples where you need to be very careful, and that's just a little bit of a heads up on what's going on up there. So I would tell you, as an African American female patient, when looking for a hair surgery, if there's any question about your history, your health history, any of your medications, the way you've lost your hair, your visits to dermatologists, that would be a red flag, and you're going to definitely need a biopsy. And I think that the ladies out there that know specifically that they have been putting tension on these areas and that's the only area of loss, pretty much these doctors on this level would be able to determine visually that is traction alopecia. But be very careful with going to the larger companies that do 5, 6 surgeries a day. Be very careful with doctors that are inexperienced and just getting their feet wet in the industry. You need to make sure that you have traction alopecia, because if you don't, it's going to be a nightmare. And that's for both sides. So this warning goes out to doctors out there as well. Make sure you do your job. Make sure you provide the best service to your patient. So that about does it for a little bit of education about African American females primarily. Don't forget, do your homework, research your doctors, make sure there's microscopes, maybe a biopsy, and you can call me. Everybody's got my number. I'm happy to help. You can shoot me over your photos. I'd be happy to share them with some of my top doctors. And don't forget to keep checking in with Hair Loss Hope. David DiMuzio's not here today, but he'll be back real soon. And thank you for watching our videos.